Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, we're going to go over a couple ways to self-mobilize your knee joint to help relieve pain and stiffness, to help improve your range of motion and your mobility. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all videos related to knee replacement surgery. So first off, I'm going to show you a mobilization technique for your knee extension or knee straightening range of motion. And again, these are great for stiffness, tightness of the knee joint, just trying to alleviate some pain and discomfort that you might have, as well as restoring your range of motion, restoring your straightening, restoring your bending range of motion. So I like to take a rolled up towel. You can use a pillow that's kind of folded in half and crunched up a little bit, or anything really similar that you have. And you're just going to put it under your calf. And you can kind of play around with where it's comfortable, so you can have it up close to the knee joint, or you can even have it down at your heel, wherever you feel comfortable, but just a little bit of a rolled up towel like this. And usually you want to be sitting up tall because you're going to be using your hands and arms. So if you have somewhere where you can sit up against a wall, or if you're sitting up on a couch and you kind of have yourself up against the armrest of the couch to help support yourself, that might be a little bit more comfortable. Or you can do this sitting in a chair with your leg up on another chair in front of you, just that might be a little uncomfortable without having that support underneath your whole leg. Alright? Excuse me. So, to do this mobilization, all you're going to do is provide a downward force or downward pressure right on your thigh or your quadricep. So you're not on the kneecap, you're not on the knee joint itself, just a little bit above it. And you want to provide kind of like this oscillation, so this kind of small motion and just doing kind of these oscillating movements up and down. You don't want to be doing this big cranking up and down like this. That's not the point of it. You kind of want to get to this point and just do these tiny little oscillations up and down. And maybe do it for 20, 30 seconds at a time, and then relax and take a little break, shake the leg out, and then try it again, doing those tiny oscillations up and down. Again, this is going to be good for pain relief, going to be good for stiffness and tightness, as well as helping to restore some of that knee extension, that knee straightening range of motion. As you get comfortable, again, you can slide that towel down a little bit lower and do those oscillations again, doing that same thing. Or you can increase the thickness of the towel if that helps as well. The next thing I'm going to show you is for flexion or bending range of motion, a mobilization technique for that. And what you're going to do is you're going to bend up the leg that you want to work on. And usually what I like to do is provide a little bit of internal rotation of the leg. So basically what that means is bring your toes so they're pointed inward or pointed toward the middle of your body, just so ever so slightly, maybe 30 or 45 degrees is good. And you could do the mobilization technique just from here. And a lot of times when you have a lot of stiffness, a lot of range of motion deficits, this may be all that you can do right now after having a knee replacement, or if you have a lot of arthritis. And usually what you do is just provide a little bit of pressure on your shin, kind of downward and toward your body. Provide that little bit of pressure, and then relax a little bit. And to make it a little easier, you can lift up the leg and provide that pressure downward. Now you can also, again, take that rolled up towel and put it underneath your leg like this. And now this is probably a little bit more mobility, or quite a bit more than some folks after surgery, but then you can have that pinching the towel in the back of your knee, and you're just providing that force again down through the shin, trying to bend the knee. If you feel like it'd be really tough to get into that amount of bend, all you can do is take a towel and make it thicker. So add another towel or use a bigger towel, or maybe even use like a pillow. And then you probably aren't having to bend the knee as much as you do this mobilization, trying to push down. And what that's doing is basically providing a traction or a separation of your shin bone, your tibia, and your femur and your thigh bone. So that separation, again, helps provide some nutrients, helps provide some blood flow, helps to provide some pain relief, decrease stiffness and tightness, and improve your range of motion overall. So one last time, like this, and then you're providing that downward force, trying to push that shin bone back and bend the knee. And usually doing it about 30 seconds at a time. Now I'll show you a way to do a similar movement, but doing it standing up and using a chair. Alright, so this is a way to do that self-mobilization for knee flexion or bending in a standing position. So you're going to take the leg that you want to work on, and you're going to put it up on a chair in front of you. You can use something similar, a stool, a step, whatever that may be. And again, you can use that rolled up towel or pillow underneath the knee to provide a little bit more traction. The only thing is that you really have to have pretty significant range of motion to really get into that deep bend, which you might not have that mobility quite yet after surgery. But again, so how to do this, you're going to bring your toes toward the middle of your body, a little bit of internal rotation toward the middle of your body, about 30 degrees or so. And all you're going to do is kind of lean forward in and out of this position. And if this is all you feel comfortable with right now, is just leaning in and out, that's perfectly fine. If you want, you can provide some pressure, so pushing down on your shin and a little bit of rotation inward on the shin as you do this. That can add a little bit of force, add a little bit of intensity for this mobilization technique. And usually doing about 30 seconds or so, maybe doing about 3 trials, 3 sets of 30 seconds is good. And again, this is trying to decrease that stiffness, decrease that tightness, improve your range of motion, provide a little bit of pain relief, either before or after knee replacement surgery. I hope you found this video insightful. Again, as always, please be sure to subscribe if you don't already. Leave your comments or questions below. I would appreciate it. And thank you very much for watching.